Yeah, so my research mentor, Dr. Richard Appelins, actually about more than 10 years ago described that there are substantial racial disparities in pediatric AML, with Black patients being about twice as likely to die from their disease. And that has not been well understood, and is part of the motivation for this study. One question was, is socioeconomic status contributing to that? And what components of that are related to, for example, disease biology? And so while it's relatively well described, we've been trying to dig deeper again into the mechanisms, because in order to target an intervention, you really have to understand why it's happening. And so we've done some work looking at initial presentation, so the time when a patient walks in the door with their new diagnosis of leukemia, and have found that Black patients are about twice as likely to need ICU level care at the time of diagnosis, meaning that they have some kind of organ failure. They need a breathing tube, they have a severe infection that's leading to their blood pressure being low and requiring medications for that, their kidneys aren't working properly and they need dialysis. Those kinds of things in the first 72 hours are substantially more common amongst the Black population. And in addition, when we look at multi-organ system failure, which we know is a huge risk factor for early mortality, we find that Black patients are about 3 times as likely to have that complication. And again, like I said, it's very closely linked to early mortality, with about a 17-fold increased risk of death amongst those patients in the first month after diagnosis. So we think that that contributes at least partially to the racial disparity, but probably doesn't explain the whole picture. So we have ongoing studies to look at, for example, access to stem cell transplant, which is a mainstay of therapy for acute myeloid leukemia, particularly in difficult to treat patients or high-risk patients. And so that may be another piece that's contributing to at least the racial disparities.